और की रहने दूँ ना, की फिर से डालूँ तो नहीं?
की वही
ठीक है,
अब आ गया।
आ गया, चलिए,
ठीक है,
ऑल राइट सर।
अपने फोन में खोल लो ना चैट के लिए।
हाँ हाँ, फोन में ही खोला हुआ है। Hi, now can you see me? Am I visible and audible now? Audible and visible too or not? I should be visible too now. AV clear. All right. That's good. It was raining. All good. Good to see you guys. Good to see you after long. Every one of you. Yes. Great. How you all are doing all these days? What did you do apart from studying? And is there any disturbance or something? Like now the fan also is on. So no disturbance. No. Everything loud and clear. Good. 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 It is done. INICET is there. Okay. I mean, the work has just started. It has not ended. And quizzes are always fun. And it won't be like a proper quiz. You people are not sitting in teams, all alone, everyone on their own. Okay. So all excited? How can I know that you people are excited? Yes, you all are here. Yes, sir. And in classes, I don't know how much enthusiastic are you for this. Is it more than the classes or less than the classes? I do not know. What no, sir? Present, sir. Hey, no, I know you all will be present. You remember that during the classes. Clear. Good. Good. It's good. All right. Okay. Wait. I'll just put it in front. Yeah. Right. So shall we begin with the questions? Guys, the point of this quiz, and I tell you, like in my UG days, in my school days and in my UG days, I was a quizzer. I did for Aligarh Muslim University. I represented North Zone also. It was general quiz, right? It was not a PERIO quiz. So I know what it means takes to be a quizzer. But for you people, being having a quizzing mind also is important. Why? Because you have to be accurate, and that's what your entrance exam also demands you to be, that you have to be accurate. आप तुक्का नहीं मार सकते, right? You cannot have chances because there is negative marking too. Most of the times, in fact, all of the times, you have to be correct with your guesses too, and guesses are calculated guesses, right? So the first question that I will ask you is, which of the following age changes are seen in periodontal ligament, right? Age changes we are talking about, right? Aging, the chapter on aging we did. And the options are scalloping of alveolar bone and PDL, decreased number of cells, decreased elastic fibers, and increased organic matrix production. So amongst these, what will be the answer? Scalloping of bone and PDL, decreased number of cells, decreased fibers, or increased matrix production? Anyone else? Anyone else? Everyone saying A. Yes. You see, guys, in this, what changes occur in PDL with age that you have to remember, that there is decreased number of cells. So option B also is correct. Remember, decreased number of cells, right? Decreased collagen, decreased matrix production, right? Okay, decreased matrix and increased elastic fibers, right? So you can see option C is D is wrong, option C is wrong, option A and B. So option B is more correct than option A, right? So decrease in cells. All the people who were saying A, if option B is not there, if option B is not there, then you will go for option A. Please remember, because I remember there are questions where you go with option A also, but in that case option B differs. So number of cells decreases in PDL with aging. So yes, option B will be correct in this case. Okay, so it will be option B. So whoever said option B, they are winning the quiz already, and it is your people's job to remember who is winning. Okay, and sadly at the end of the case I do not have any hamper to give you. Okay, so this clear with aging, and I am telling you all other questions which can be asked. Total number of cells decrease, total number of collagen fibers decrease, because number of fibroblasts decrease, and also number of epithelial rest cells, they also decrease. Remember, right? Next question, and this is an important question, question number 2 or 98. Here it is written: periodontal prognosis for a tooth with grade 2 or grade 3 furcation, right? Grade 2 or grade 3 furcation is there. All right, sir, zoom questions. Okay, you cannot see. Right, wait. First I'll zoom in the questions, then it will be easier for you. Is it better now, guys? Too much noise in the background, sir. Okay, wait. The noise would have decreased by now, I guess. And is it clear now? Better? Is everything better now? Is it better? Can you see it better now? Everyone? Yes, good. So now this question, periodontal prognosis for a tooth. Guys, concentrate on what's there in front of you. First solve the question, then you will get the questions. Okay, do not start worrying about the questions. Okay, first solve these questions here. All right. Now, prognosis for tooth with grade 2 or grade 3 furcation, right? Grade 2 or grade 3 furcation is there. furcation grade 2 or grade 3. Okay, mobility is there and bone loss plus greater than 50% attachment loss. Okay, so what kind of prognosis it would be? Fair, poor, questionable, or hopeless? This you have to tell. Fair, poor, questionable, or hopeless. Furcation involvement is either type 2 or type 3 or grade 2. Sir, please explain stage grade classification. Yes, of course, I will. But first, whoever know, someone is saying C, someone is saying B, which means poor, hopeless. I am getting every option in the answer. I'm getting every option. No. Now I will tell you how to go about this. You see, the prognosis could be good, fair, poor. Okay. There are categories: good, fair, poor, questionable, and hopeless. All right. So these are the categories, right? Now, good, when there is no furcation involvement, there is no mobility or anything. All right. Then the fair, poor, and questionable. These are the ones on which question will be asked, right? And hopeless is the one where you will do extraction. Okay. Now, the fair is where there is only 25% attachment loss. Okay. And only grade 1 furcation involvement is there. Poor will be up to 50% of attachment loss, up to 50%. And grade 2 furcation involvement is there. In questionable, greater than 50% attachment loss and grade 2 or grade 3 furcation along with the mobility. And that's what this question says. Okay, so there is grade 2 or grade 3 furcation and there is mobility and there is 50%, more than 50% attachment loss. So answer will be questionable, not hopeless. In hopeless, there is almost no attachment is there, right? Around, you say, in the apical third, the bone is there, right? So for 98, it will be, I'm writing here officially, it is C. Okay, so for 98, it is C. People who said B, people who said D, remember, this question will be confusing between fair, poor, and questionable always. If the question says there is no furcation involvement, there is no attachment loss, so the prognosis will be good. But if 20%, 50%, and it will be greater than 50% for questionable, this you have to remember. Clear? Clear or not, everyone? Whoever said B, whoever said C, they are right. Okay, but whoever said B and D, is it clear to you people? Next question. What is the name given to the portion of the tooth where calculus or altered cementum is found? Where calculus or altered cementum is found. What is the name given to that portion of the tooth? Tell me. What is the name given to that portion of the tooth? Where calculus or altered cementum is found. Now this question, they are referring to when you are doing scaling. Okay, where they are doing scaling. So that's why they are saying. So it will be, it's an easy question. Good. Let's see who all are answering. More in favor of C, very few in favor of B. Good that I have not seen A or D yet. Good. So the answer for this question will be C. It will be instrumentation zone. Doc, it cannot be the altered zone because you can say there is altered cementum. There is no altered zone as such. Remember, pathological zone where there is plaque, right? Where there is plaque. But where calculus or altered cementum, that is the instrumentation zone. Okay, that is the instrumentation. There is no periodontal zone as such. And honestly speaking, Karanza does not speak in these terms also. But yes, a question of this kind can be asked, and we have to be ready for any kind of question or for every kind of question. Okay, so that's why the answer for this particular question will be instrumentation zone. Right? Do not get confused. The word here altered is given, so you will go with altered zone. Okay, it won't be altered zone. So clear? Instrumentation zone. I don't think most of you, all of you will do it correctly. No one of you should do it incorrectly. Instrumentation zone. Correct. Moving to the next. Very easy question, but one of my favorite questions. And I hope no one is having their notes opened in their phones or laptops or mobiles. Okay, and I do not know how many of you are doing this quiz combined. If there are people who are with their friends also amongst you, right? You should not be doing it together. Do it alone. Okay, take it as an exam. Moderate to light pull stroke. Moderate to light pull stroke is used for. It is about strokes. Strokes. Question number 100. Moderate to light pull stroke. Light pull stroke. Pull stroke. You people tell. Most of you should write. I have got A, I have got C, I have someone had said scaling also, someone is saying route planing. No takers for curettage and exploration yet. Most of you are saying C, and few people are saying A also. So we will wait. And someone has said B also, curate also, curettage also, someone has said. Route planning, very few in favor of A and B. Docs, don't do this kind of thing. Please don't disappoint me. Don't disappoint me. If you remember, while doing this chapter on scaling and route planning about instruments, I told you the scaling stroke is powerful pull stroke. Scaling stroke is powerful pull stroke, while route planning, RP, is moderate to light pull stroke. Okay, and what is the exploration stroke? Exploration stroke is light feeling stroke. Okay, so the correct answer will be route planning. Come on, don't say scaling, don't say curettage, people. I mean, it's not bad for me. It's bad for you people only, not for me. Okay, so the correct answer will be C. Cannot be scaling. And for curettage, yeah, I know you can get confused between route planning and curettage, but the correct answer will be route planning. Curettage is not, it's yes, moderately powerful pull stroke, but the better answer is route planning here. I mean, most of it. D also people have said. No, doc, please don't go for exploration. Exploration, I told you, no, light feeling stroke. If you get confused with curettage, that I can understand. But if someone says scaling or someone says exploration, it means you are not thorough with the subject yet, and you have just appeared in NEET. So this kind of, I mean, these are the silly mistakes. Okay, these are the silly, and these are the things that we had done in our theory classes. We did it or not? You tell me. We did it. Every time we were doing these things. Okay, now next question. 2-point surface contact instrument. Which instrument makes a 2-point contact? Simple question, straightforward question. And these kinds of questions only are asked. Okay, 2-point contact. No, it was, yes sir, it's on notes. Yes ma'am, yes, you are right. It's on notes, in your book, everywhere it is. Now I'm asking 101, 2-point contact. 2-point contact. See, now till now most of the people are saying, oh, I'm waiting if someone says A, B or D. I'm waiting for people saying A, B, or D. Anyone for A, anyone for B, anyone for D? Anyone for A, B, or D? No takers for A, B, or D yet. Okay, someone said B, which means for curate, you are saying 2-point surface contact instrument. Okay. You have my attention, doc. Okay, someone said A also, chisel. Okay, you also have my attention. Again, someone saying B. People, I told you, no, hoe is the only instrument which has a 2-point contact. Okay, hoe is the only instrument with a 2-point contact, right? Its blade is bent at how many degrees? Blade is bent at how many degrees? No A, no D, come on. Don't give this sort of answers. Blade is bent at 99 degrees. It is used to remove ledges or rings of calculus, right? I may ask you here one more question. Which of these 4 instruments, chisel, curate, hoe, or file, which is used in push motion? Which instrument is used in push motion? Blade is bent at 99-degree, doc. Yes. Which of these instrument is used in push motion? Not 45. Come on, just like the 45. No. Don't say all these things. Which instrument is used in push motion? All are used in push motion. Which is used in, all are used in pull motion. Yes, chisel is used in push motion. You must be ready for all the questions. Yes. But for this question, answer is hoe. So for 101, it is B. Good. You people see the images and then it will be clear to you. So are you guys enjoying the questions till now? Shall we move ahead or we should stop here? You tell. Interest developed for the questions. People who are, so please explain stroke for curettage. Good that you have asked questions. See, curettage is not a definitive treatment. Root planing is removing the calculus and altered cementum from root surface. Curettage is just you are scraping the gingival wall of the pocket, right? That we do in curettage. So the stroke of curettage will always be a pull stroke, but it will be very light pull stroke. Okay, it will not be even moderately powerful. Okay, it will be light pull stroke. Okay, it will be light pull stroke. That will be a curettage stroke. But generally, the root planing, curettage, both these procedures we do with curate. So the stroke, since the stroke is talked in terms of what is a definitive procedure, scaling is a definitive procedure, root planing is a definitive procedure. So we talk in terms of those. Curettage is not a treatment modality. We do not achieve with curettage apart from just removing the bulk of the dead tissue. Okay, you do not get any therapeutic advantage with curettage. So that's why book also does not mention stroke of a curettage. What if we do push with hoe? You will put the calculus back. What you do with dirt? You take it out of your home. You don't take it in, right? So if you do push with hoe, your calculus will go inside the sulcus, right? Yeah, root root planing is also removing soft tissue wall. No, that is your curettage. Soft tissue wall of pocket is your curettage, right? Next question, one of my favorites. Right, next question is one of my favorites. Initial colonizer complex is of which color? Initial colonizer. Initial colonizer. A, B, C, and D. Yellow and purple, yellow and orange, green and orange, red and green. Tell guys. $102. Till now I have seen A, someone had said B also. Yellow and purple. Most of someone had said again B, 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 Y, B, 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 B. C. Anyone for C and D? Anyone for C and D? And those people who have said A, are you sure it is A? Okay, someone again has said B, but still no takers for C and D. Initial colonizer means they are talking about primary colonizer. Someone said B, again said B. Which color pen I am using right now? Which color is this on your screens? Which color is this, docs? This was a hint for this question. Yes, sir. SUREA. Sure A. Okay. Yes, good. Being sure is very, very important. Purple. Yep. Yellow and purple it is. Initial colonizers, primary colonizers. What is yellow? What is yellow and what is purple? Yellow is which bacteria? Which bacteria in yellow? Strepto. Except for one, and that is S. constellatus. Where does S. constellatus go? S. constellatus go in orange complex. And what all come in purple complex? In purple complex, there is V. parvola and A. odontolyticus. Yes, or you see, remembering Streptococcus is important, but remembering Streptococcus constellatus is more important. Okay, everyone will, because if they ask in exam which group Streptococcus constellatus belongs to, if you people just pay attention on Streptococcus, you will mark yellow. But species also you have to remember. So if it's about constellatus, then it will be orange complex. In red complex, which all bacteria come? I am asking you. In red complex, which all bacteria will come? You people please tell me. In red complex, what all bacteria come? Tell me. Red complex bacteria. Tell guys, tell. Yep, good. Porphyromonas gingivalis, Stanarella, Forsythia, Traponema, Denticola. This is the way to answer. Very good, doc. You wrote all three in one. Good, good. Moving on to the next one. This is an interesting question. Take your time and then answer this question. Do not answer this in a hurry. This 103. Which of the following is not a feature of localized juvenile periodontitis? Not a feature. All right, not a feature. Degenerative disease, option A. Option B is involves incisors and molars in the localized form, occurs with equal frequency in males and females, rapid bone destruction compared to normal periodontitis. Which of the following is not a feature of localized juvenile periodontitis? Question number 103. Good. I'm seeing few people also answering as A. Now the people who are answering it as A, can you please tell? Males more, therefore C. Seriously, no. Guys, in this question, options A and option C both have a bit of confusion, right? Option C says occurs with equal frequency. Our Karenza says there is slight female predilection. Okay, so that's why we go in this question with option C. Now, people who have said A, I also was in favor of A when I first approached this question. But since it is talking in terms of like when the language of the question is localized juvenile periodontitis. Now, this term is not even used. But when this term was being used, localized juvenile periodontitis, at that point of time, it was thought as a degenerative disease. Okay, initially it was thought to be a degenerative disease. Now we know it is an inflammatory disease, not a degenerative disease. So that's why people who are saying it as A, they also are correct in some way. But if option C was not there, we would have gone with option A for sure. Okay, but in this question is a bit confusing. We will go with option C. Option C seems more correct because in Karen's at one place it is written that no variation was found between males and females. It is written, okay, but since it is also written in studies, it has been found that there is slight female predilection. That's why we go with option C as the answer, right? Because since the inflammation is so rapid, people take it as a degenerative disease. Okay, so because you see A is debatable, but C, when option C is there, you will have to go with option C. All right, so that's why people go with option C if this question comes, and you people will write what are the primary characteristics of localized aggressive periodontitis. You people tell me what are the primary characteristics of localized aggressive periodontitis. Okay, so option C is correct for this, but tell me the primary characteristics of LAP. You people write, because that is an important question. If you can write the primary characteristics of LAP, I will consider you people are studying. Rapid bone destruction, yes. Good. I'm asking the primary characteristics of LAP. Primary characteristics. Very good, doc. Very good. Dr. Mahajan, very good. Arc-shaped bone loss is not a primary characteristics. People, if you see the notes, you will find it. What are the primary characteristics? Number A, rapid bone loss, rapid attachment loss. Otherwise healthy individual in spite of so much bone loss. And C is familial aggregation. Right? These are the primary characteristics. I specifically asked this because this question, if asked, you people cannot do wrong because it will hurt me. I strongly laid emphasis on this point. What are the primary characteristics of LAP? All that distolabial migration of incisors, deep dull radiating pain, thermal and tactile sensitivity. All those are secondary characteristic. Arc-shaped bone loss, right? From distal of second premolar to mesial of second molar. All those are, what does this say, Dr. Vishwas? You might be good at sign language. I am not. What is this? Yellow complex and green complex. What you have drawn here? I mean, are these two bacteria or what? Younger patient, less plaque. Yeah, dog, but I mean, that is not primary characteristic. Primary characteristics are these three. All right, Dr. Priyansh. You can see. Whoever is saying arc-shaped bone loss and all, no. These are the primary characteristics of LAP. Next question. Which of the following disorder does not cause gingivitis? Does not cause gingivitis. Or you can say gingivitis is caused by bacteria only, which will not affect gingivitis. You can take it as that ways also. Okay, so options are puberty, pregnancy, diabetes, or hypertension. Hey, I mean, if you are in front of me and saying diabetes as the answer for this, I would. How can you say diabetes for this? Diabetes. If you have hypertension in front of you, how can hypertension cause? I mean, hypertension will cause gingivitis, but diabetes will not cause. Come on. Come on, people. How can you say? I mean, this is a straightforward. This every one of you should do correctly. Yep. Secondary criteria all good. But this diabetes, man, periodontitis is the 6th complication of diabetes mellitus. So it will be there, gingivitis. And the question language, it is like this in your book. Okay. 104A. Come on, man. Come on. Don't do this. I mean, I was struggling with diabetes. Now you are coming with puberty. If puberty and pregnancy both are in the options and they both imply the same thing, which is hormonal changes. So if A is the answer, then C has to be the answer. No. So D is the correct answer. Hypertension has nothing to do with, I mean, hypertension, like you see, puberty, pregnancy, what do they do? Hormonal change. And right, hormonal, what they do with blood vessels? They change blood vessels, they change keratinization, right? And diabetes have effect on collagen, have effect on PMNs. Hypertension, no such effect on anything which can affect your gingiva. Cut throat competition. Yes, dog, there is cut throat. And I mean, just not cut throat. You are there to cut everything. This competition may piche nahi rehna. More questions? You want more? Or are we done? More questions or are you done, guys? Calcium channel blockers can cause gingivitis in hypertension. You are going with drugs. Calcium channel blockers will cause gingival enlargement. All right. But that is when you are giving the treatment. Very good. AGE is very good. Very good. Give me more. सोओगे नहीं तुम लोग, है ना? ना मुझे सोने दोगे, कोई नहीं, चलो. A tooth has gingival recession of 4 mm on buccal aspect. I don't think you people have done this question. More question. Yes, dog. Your wish is my command. A tooth has gingival recession of 4 mm on buccal aspect. Right? Buccal 4 mm and 2 mm on mesial and distal. Which means interproximal 2 mm. And that is recession. They are talking about recession. So they are asking according to Cairo's classification. Cairo's classification is not something we read during the classes. And that's why, since a question was asked, I came across this question, guys. Yeah, there will be a surgical part also. There will be questions. Just wait. Yeah, nifedipine CCB is there, but you are going towards treatment. In that ways, everything can be the answer, right? But when it's the disease, the hepatitis is a disease, then you will go with hypertension. No, because diabetes is already there. How can you discount diabetes? Now here, come back. Cairo's classification, I tell you people, you wouldn't have read Cairo's classification. So I would request you, if you do not know the answer, do not attempt. But if someone knows the answer, then you tell me what should be the answer for question number 94. Because for that, you need to know the Cairo's classification. Now, Cairo's classification is different from the Miller's classification. Miller's classification gives emphasis to mucogingival junction. Cairo's classification does not involve mucogingival junction at all. It gives emphasis to recession or tissue loss on buccal and interproximal aspect. Okay, it talks about recession, and it has 3 gradings. Class 1, it has 3 gradings. Class 1, Class 2, and Class 3. Okay, now I'll show you the images also for this. Class 1, there is only buccal loss. Okay, not very important, but whatever is there in Cairo classification, I'm telling you here only. Okay, so it cannot be class 1, right? So option A cannot be your answer. And since there are only 3 classes of this recession, only 3 types, so D also cannot be the answer. Okay, now what is Cairo's class 2? Cairo's class 2 is there both buccal as well as interproximal, but recession on buccal is more than interproximal. Okay, so here buccal is 4 mm, interproximal is 2. So B definitely will be the answer, but you need to know the class 3 also or type 3 also, because if that question is asked, you will need to answer it. It says interproximal recession is more than the buccal recession, and that will be your Cairo type 3. Okay, so this option C also is incorrect. So the correct answer will be Cairo's type B. Okay, so whatever is there in Cairo classification, I have told you, but Cairo classification is not followed. I mean, none of the classification is followed apart from the Miller's classification, because it gives importance to the treatment. How do you do the treatment? Okay, so done. Cairo's classification done, guys. Then, next question. Not a clinical indicator of TFO, not a clinical indicator of trauma from occlusion. Not a clinical indicator of trauma from occlusion. Parameters, tooth wear, tooth mobility, increased width of PDL space. You give me an answer here. You people give me an answer. You people give me an answer here. So please explain stage and grade classification of what? I'm asking 95 and someone has just said A for 95 and C for 95. You people tell me I'm talking about clinical indicator, and someone had said mobility is not a clinical indicator of TFO, and someone has said parameters is not a clinical indicator. There is a parameters test which you do clinically. So how can you say it is not a clinical indicator? How can you say it's not a clinical indicator? It's a simple question. I mean, tooth mobility is the most important clinical sign of trauma from occlusion. We all know. Plus tooth wear, it will be there with trauma from occlusion. And parameters also. Parameters test we do to test mobility. Right? We all know. So it's simple. It will be increased width of PDL space. How can you see PDL clinically? PDL is below the gingiva, no? So PDL we cannot see it clinically. We see it only on the radiograph. So it's a simple question. Whoever's, I mean, A or any other option, That can be disturbing. It means you are taking too much pressure to solve the question. Be relaxed, right? I mean, I'm not saying you did not know the answer and that's why you did it incorrectly. You know the answer, but you're taking too much stress on yourself to do it correctly. Just relax. Okay, do not get tense and do not be afraid to do it incorrectly. There should not be any undue pressure on you. Yeah, it's not clinical. As simple as that. Next question. Pocket in which lateral wall of the pocket is present between the tooth and bone. The wall of the pocket is present between tooth and bone. Compound, gingival, suprabony, infrabony. Yeah, I said Miller's classification helps us to assess treatment because Miller's classification is about mucogingival junction position, and that can help in assessing like whether we can do it or not correctly. So that's why I said it helps in assessing treatment. Wall of the pocket between tooth and bone. Can't it be suprabony pocket? Why cannot it be suprabony pocket? You people tell me. Because it is lying between the tooth and bone. So I'm asking, why are you not thinking it as suprabony? Good. Good. Very good. Very good. 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 Very good. Next, which of the following will serve as etiological risk factor for ANAG? Which of the following serve as etiological risk factor? Developed economies, puberty, malnutrition, or pregnancy? Yes, it's a simple question. I have to put. I'll see if someone says A, C, or D. And what can be the other risk factors for ANAG? Again, you see, someone said A. Developed economies can be an etiological risk factor for ANAG. Dog, you cannot say that. ANAG, see, ANAG. What did you study in ANAG? We studied ANAG. It occurs in immunocompromised. That is the first thing for ANAG, immunocompromised, where deficiency of vitamin C, vitamin B12, right? Smokers, all these, right? Stress. Fine. So developed, it's simple. It will be malnutrition. Okay. So, sir, from which book these questions are taken? Am I taking your quiz or you are taking my quiz? Tell me. It's your quiz or it's my quiz? You cannot ask questions other than what will help you in your exam. Your secret, I'll tell you later from which book these questions are taken. Okay, moving on to the next. True about necrotizing ulcerative gingivitis. Frequent episodes occur in children. Contagious. Acute infections confirm some amount of immunity and no definitive duration. Tell me. True about necrotizing ulcerative gingivitis. Tell. If you remember, during the class, I told you NUG is transmissible, not contagious. What is the meaning of contagious? That it can spread through vectors, through air or water. And no, NUG cannot spread. So B cannot be the answer. B is definitely incorrect. What you will do now? And C also will be incorrect. Acute infection confirms some amount of immunity. It occurs in immunocompromised and this will give immunity. No, there are no antibodies as such. C also is incorrect. Sir, what is contagious and what is transmissible? Did you take my classes or not? On NUG, did you take my classes? Yes, transmissible, not contagious. Dog, you explain what is transmissible, what is contagious. Transmissible is, it can transfer from one host to another through direct contact between two hosts, right? It is direct vertical transmission. Okay, but contagious means you take water, you share air. Okay, you cough, you sneeze, and it can spread. Droplet infection through vectors. Okay, bacteria, mosquito bites you and then some other individual like that, like malaria. Okay, so the correct answer is D. There is no definitive duration of this disease. Yes, it has an indifferent course, if you remember. This disease has an indifferent course. Okay, it can spread to NUP, it can spread to NUS. Right? It has no definite duration. Yes, herpes simplex virus, primary herpetic gingival stomatitis. It is of limited duration, 5 to 7 days. We have already seen that. Okay, so this was a good question. So people who said contagious, no, I'm disappointed because this is the point which I laid emphasis on while we were doing the classes, that it is transmissible, not contagious. Right? So next question, identify the instrument shown in the image. These are explorers. Okay, so explorers image are there in the classes also. I showed you explorer images. Okay, so these are, and these images are taken from Kerenza only. Yes, they are. You people have to tell which explorers are these. Yep, these are 23 and 17 explorers, right? These are number 23 and number 17 explorers. Good. This was an easy question. Like, see, you have to remember, you have to see the images 1 or 2. And now we come to the last question for tonight. This is the last question for tonight. Identify the defect shown in the image. Identify the defect shown in the image. Which is this defect? No options for these. So for reference, which week to refer for INICET previous year questions? The same books which you were doing for NEET, you can do for INICET. The questions will mostly be the same, like these sort of questions will be there. They'll lay more emphasis on images and your reasoning based questions. Now, which of these, like if I say this is A and this is B, so what is A and what is B? This is the last question for tonight. What is A and what is B? Two people. One said B is fenestration, one said A is fenestration. One is right, one is wrong. Good. Yes. A, there is complete loss of bone. Right? In B, periosteum is still intact. So this makes it easy. Complete loss of bone, dehiscence. Periosteum intact, fenestration. A dehiscence and B fenestration. And these two are also called as zero wall defects. More common in anteriors than posteriors. Zero wall defects. So guys, this brings to the end of today's quiz, and I know you people are not yet like you're feeling like there should be more questions. So in one day we will not do all the questions. Day after day I'll be there in front of you. There are other subjects also that you have to take quiz of. Did you people like it or not? Did you people like the quiz or not? Did you like the questions or not? In 98, why not A? Frequent episodes, because there are no frequent episode as such, right? Generally just once or twice. It will not be there. Sutures, I will explain later. Awesome. Good night, sir. Oh, okay, you are ready to go. Can you give me 1 or 2 minutes? Yes, I won't take too much a long time. Yes, I know this is what, Saturday night. I took a quiz on Saturday night. I ruined Saturday night of you people. Sir, can you take classes on periodontal indexes and app classification before INI, sir? Yeah, we will work out on that. Yes, I liked it. You are from Nepal. Hi, Doc. How are you? How is it in Nepal? I hope you are doing good. Whenever I come to Kathmandu, I'll definitely contact you. I'll definitely contact you whenever I come to Kathmandu. Okay. And what do we mean by zero wall defects? We mean by zero wall defects like they do not involve any walls. We have 1 wall defect, 2 wall defects, 3 wall defects. Where do they occur? In the interproximal spaces. That's why there are walls. But this does not occur in the interproximal spaces. They occur on the buccal wall or the palatal wall, maybe. Okay, so that's why there are no walls. That's why we called it zero wall defects. Daily quiz, yeah, there will be daily quiz. Oh, you are still here even after saying good night. Which means you want, like, if I had more questions ready today, you people would have done them, right? So in the next quiz, I hope more of you will be there. Okay, we will make it better next time. That's what I want to do every time. Today, what I did was to the best of my ability for tonight. Next time, I'll try to better it. That's how I go about it. That's how you people also should go about your business, right? Yeah, contagious and communicable is the same, but contagious, communicable, transmissible are different. Okay, So good night, guys. Happy studying. Stay good. The weather is changing. And it was Saturday night. Yeah, I mean, I'll discuss all the questions later. You do gingivectomy, you do flap surgery, same when you have to do when there are more than 6 teeth involved. Okay, so which flap does not matter. What matters is whether you have keratinized gingiva enough or not. If there is less gingiva, then you will go for apically displaced flap. Right? Good night, guys. Good night. Happy studying. Stay happy. Stay healthy. Right? Be responsible and be sensible and always stay positive. Right now, I'm signing off. Yeah, all the ways are simple. I'll tell you in the next quiz, we will study that stage and grade classification. Okay, so now I'm signing off.